Welcome to Evergreen Family Medicine. We are with Dr. Emmanuel Okenye, and in this episode, we want to talk about osteoporosis, and maybe a refresher for some people. Maybe there's others out there who know a lot about it, but we're going to learn more about osteoporosis. Thank you for your time.
Thank you. Thanks for having me.
Sure. What's a definition of osteoporosis?
So osteoporosis refers to a condition where you have weak bones, basically, and the bones are more likely to break, basically. The minerals that make up the bones, basically, the bone begins to lose those minerals, the important components that make up the architecture of the bone begins to kind of get lost. Gets lost because of multiple different factors. And so certain patients, of course, as we get older, are at risk for getting osteoporosis. And so those are the patients that typically we tend to look out for this condition.
So what are some ways to avoid or maybe slow down that process of osteoporosis?
Important that you eat, healthy diets, vitamin D, fish, calcium is very good. Patients, making sure they stay active. Patients that tend to be not as active, at risk, higher risk, and also making sure, don't smoke, and limiting your alcohol intake to 1 or 2 drinks a day. Those are the things that we look at, to help kind of reduce your risk. Of course, you might want to know which patients we typically test. Again, there are guidelines that we follow, and patients that are over the age of 65 there's evidence to show that these patients are more at risk.
So how do you test for osteoporosis?
Your doctor would typically order a test called a DEXA scan. It's like a special type of X-ray, and so that test basically gives us a scoring system. It looks at different joints and gives us a sense of how far gone, how bad or how good the bone is in those different areas. In the hips especially, we look at that because again, when patients start to fall and they break a bone, you shouldn't normally break a bone from a fall, but when you begin to break bones, then that's kind of a concerning finding.
So what are some treatments for osteoporosis? We talked about prevention a little bit. How do you treat it?
So those patients that do get diagnosed, there's multiple ways to treat multiple medications that are out now. The most common one is one called the bisphosphonate, and so your doctor would typically put you on that regimen, and it's a weekly regimen. Patients just take that once a week. Of course, there is a limitation. There's recommendations that they don't take it for more than a few years, and so. Now, for some patients that don't do well on that medication, that have allergies to the medications, there are other medications that your doctor could also consider.
Excellent. Well, as usual, it sounds like prevention is the best way to deal with osteoporosis.
Absolutely.
Yeah.
Absolutely.
Well, and we want people to be healthy. That's why we talk about these issues here on the Evergreen Family Medicine YouTube channel. And you can also learn more about Evergreen Family Medicine, not only from evergreenfamilymedicine.com, but also continue following us on our social media channels, Facebook, Instagram, YouTube, and Twitter.